Feroci or Renee?
Okay, go ahead, Lindsay.
On talking to about patients with adherence, I really struggle in our institution with having anything in other languages at all. And I mean, and you'd think Spanish would be pretty simple. And in our patient resource center, we have kind of like one tiny little wall that has other languages, and we might have, I don't know, 8 things in Spanish and maybe a couple of things in French, and that's all we have. And so, any ideas or resources on any of the medication adherence in other languages?
I don't remember off the top of my head, but I know that I've had residents, pharmacy residents working with me who found things just by Googling. We'll have to go back and look, but sometimes the problem with those sites is that they're not updated very regularly. So I think one thing to consider, in an oral chemotherapy adherence program, or even just an oral chemotherapy program in general, is, again, finding, identifying those gaps and where we can close those gaps. So something like this, where there's a need for specific education, we might just actually have to create our own and find someone that can translate appropriately all of the information. Those handouts that I talked about from the oral chemotherapy education website, they're great, and it would be so wonderful, and maybe something that I should suggest to them to do is consider bringing in other languages, at least the more common ones, so that we can really provide comprehensive education to our patients who have needs in other languages. So I'm writing that down right now, actually. We're counting.
In regards to the oral chemotherapy adherence, for RC, I remember you having that page of questions for us to take back as nurses and physicians to our own institutions and evaluating what type of system do we have here or within our institutions and how we might be able to improve it. So I was just curious in regards to our audience, what type of systems do you have at your facility to monitor oral chemotherapy adherence? Mary?
We have an assigned nurse, so that's her role. We each have a little side role from what we really do, and extra duty kind of thing, and that is hers. And one of us tries to help replace her when she's not there, but there's really just one main girl, and she knows it, and she has her day twice a week. We try to give her two days a week out of her 5 days.
organization is I actually have my insurance reviewer, and she has become patients' new best friend because she is the one that knows how to get those papers processed for all of the prescriptions. Working with the specialty pharmacies, she's also my go-to person for the patient assistance programs. And so the process that we've set up is that she will get that stuff put in place, and then once patients have their oral chemotherapy, when they have their pills in hand, they bring that in and they meet with either myself or else one of the other nurses. And then we do the teaching at that time, because that way we can do that double check and make sure they have the correct prescription, it has the correct instructions on it, they know how to do it, this is what the pill looks like, don't crush it, you know, all that kind of stuff. And then they walk out and they're ready to start. So sometimes that means we are seeing patients at the drop of a hat, but depending on when the package was delivered, but we've found that works. And it keeps the nurses off the phone waiting forever for the insurance companies and the registration and that kind of stuff.
We want one of those. A financial officer in our clinic, that would be nice.
They are worth their weight in gold, and they will do it, they'll pay it back in reimbursement.
To God's ears, thank you very much. We would love one.
Where I worked previously, we did have a patient advocate for all the chemotherapies. If they were, it would go to the pharmacy, our pharmacy, and if it was not covered through our pharmacy, then it would be specialty, and they would get it pre-authed or approved, find out which specialty was sending it, when it was going to be delivered, and they would be in contact with the patient. The patient would call, or the family would call, when it was delivered, and then we would schedule the education as well. Then our electronic medical record had the treatment plan on a weekly basis under triage. The triage nurse, it would come up, and they would call every week. How many pills do you have left?
Oh, wow.
How many, what side effects? How are you, tell me how you're taking this. And we had it even to, depending on what the drug was, what the side effects specifically they would ask about. So capecitabine, mouth sores, diarrhea, nausea, that kind of thing. So it was very well planned out. And the nurses rotated through triage, but it would come up on their list, daily list of who needs to be called. So it was very well done.
I just had a couple of thoughts I wanted to share, Renee, with the preventing burnout and compassion fatigue. One point was just, as you were saying, making sure that people take breaks, because I don't know about any of you, but my first several years of careers, you never had a bathroom break, right? You just work your 8-10 hours and you just went, and you didn't take time to go to the bathroom. So ensuring for breaks is really a great idea, because sometimes as nurses we are forced to do things, because a lot of times our career is really based on being as efficient and getting as much done and fulfilling all those orders that are written in an X amount of period of time. The other thing is I want to share that's I think been really helpful at Peace House St. Joseph is that our chaplaincy program has instigated what's called a blessing of the hands, where the chaplains have gone around, and it doesn't matter what, it's open for everyone, staff level, in regards to LPNs, nurses, physicians, front desk people, where a chaplain will go in, and it's more like a ceremony, but it's really a time to hear just the gratefulness the chaplain will go through and say how important your role is and how you are such a valued caregiver. And as a recipient of that, as they're washing your hands, it's just feeling, you're getting that confirmation of the role that you play in healthcare. And it's really quite meaningful, and it only takes like 5 minutes out of your day. So that's something I know that we've incorporated that's been really helpful. And then one other thing is, I recently finished a mindfulness course for professionals. And it was a course where there was physicians, nurses, and dietitians and everything. And And it was a struggle because it was a 5-week course. It was like 2.5 hours apiece, and they went around the room saying, okay, you know, how to implement some of the practices. And I raised my hand and I says, okay, I'm getting stressed out just trying to figure out how to implement mindfulness into my every